Identifying a good panoramic 2D image. When capturing an image, you want to ensure that the image has the following. 1. That the patient's chin is centered. It matches with the position of the midline and the anterior teeth. 2. That the smile line or the occlusal plane is present, separated and gently turned upward. 3. The hyoid bone appears at the same location on the left as it is on the right side. Some misaligned panoramic images. If you have a panoramic image that shows up with an enlarged anterior area, the causes might be misaligned canine laser beam, and the patient is biting on the tip of the bite stick groove, which is too far back. To adjust or fix this issue, have the patient bite into the groove of the bite stick and ensure the midline and canine beam are aligned. Blurry and enlarged lower anterior area. The causes of this are the patient's lower anterior area is moved too far back. The misaligned canine beam is also not positioned correctly. To fix this issue, have the patient bite into the groove of the bite stick and ensure midline and canine beam are aligned. Shortened lower anterior area or deep smile line exaggerated smile. The causes of this is that your patient head is tilted downward, which means that the Frankfurt plane is not parallel with the floor. To fix this issue, have the patient raise the chin rest until the Frankfurt plane is parallel with the floor to ensure the Frankfurt plane is placed under the orbit of the eye towards the tragus. Lengthen lower anterior area and frowning smile line. The causes of this is that the patient's head is tilted upward. The Frankfurt plane is not parallel with the floor. To fix this issue, lower the chin rest until the Frankfurt plane is parallel with the floor. Asymmetric TMJ and enlarged posterior area. The causes: when the patient's head is tilted sideways, or if the patient's midline is not aligned with the mid-sagittal laser beam. To prevent this, help the patient adjust their head so that the midline aligns with the mid-sagittal laser beam. Elongated or leaning arch on one side. The causes of this is that the head is turned to the left or the right. To fix this, make sure that the patient is holding onto the handles with both hands positioned symmetrically and position the head to the face straight forward. Blurry or haze around the center lower area of the image. The causes of this is that the patient is not standing in an upright position. Curvature in the back and neck causing spinal artifacts in the image. Chin rest is too low, causing patient to hunch down to meet the chin rest. To fix this issue, instruct the patient to take a half step forward until feet are directly under the handles of the machine. Instruct the patient to stand up straight. Chin rest may need to be adjusted upward to accommodate the patient height. Darkening on maxilla. Large haze around the mandible. Causes: the tongue is in a resting position. To fix this issue, instruct the patient to swallow and press the tongue on the roof of the mouth and hold it there until the imaging is completed. Cone-shaped artifact at the bottom of the image. What causes this is that the lead apron is too high on the patient's back. To fix this issue, Make sure the lead apron is situated low on the shoulder blades and not riding up onto the patient's neck. Metal artifacts visible on an image. What causes this? Failure to remove all metals from the shoulder upward. To fix this issue, always instruct your patient to remove all metals, including their earrings, glasses, retainers, and hairpins. To identify a misaligned CBCT 3D image, tilt or slanted image on the left side. The causes of this is that the arch is not centered. Patient's head is turned either to the left or the right. To fix this issue, reposition the patient's head so the midline is centered. Blurry image on the right side. This is caused when the patient was moving during the acquisition. To fix this issue, instruct the patient to hold still during the image and close eyes. Metal artifact. Failure to remove any metal will result in an object being shown on your CT image. Please ensure that your patient removes all metal, including glasses and earrings, hairpins, retainers, and also dentures. Anterior/incisors cut off of the image. When your patient does not bite in the groove of the bite stick, here you would see the incisal edge of the anterior area being cut off. The causes of this is that your canine beam is located behind the incisors. To fix this issue, always adjust the canine beam in the front of the anterior teeth and also make sure that your patient is biting in the groove of the bite stick.